Hello, welcome to South Today. I'm Sally Taylor. The headlines tonight.
How are you today?
They're at the core of frontline NHS staff, but Filipino health workers tell us they are paying a heavy price for the pandemic.
Every day I looked for their names. Were they still there? Were they still alive?
Throughout the pandemic, there's been a focus on the dedication of health workers on the front line. But Filipino workers have told South Today they fear they are more vulnerable than others to the effects of coronavirus. Official statistics are hard to find, but it's thought that of more than 300 NHS and social care staff who have died from COVID-19, 1 in 5 is believed to be Filipino. We've been speaking to staff at the trust that runs Bournemouth Hospital. 18 Filipino staff have been ill with coronavirus there. No one has died, but there are still serious concerns. Here's our health correspondent, Alastair Fee.
Everybody loves him, even colleagues, patients, so he's really a nice person.
Remembering Lani, a husband, a father and a cousin to Christian. He caught COVID-19 while working in a Surrey care home.
I wasn't really expecting that he's gonna die. We've lost a really good person.
This summer, Lani Zuniga's wife, 2 daughters and son were due to join him from the Philippines and start a new life here.
I will.
On the front line in hospitals and care homes, Filipinos have been hit harder than anyone. The Royal Bournemouth and Christchurch hospitals employ more than 150 people from the Philippines.
Our staff that went into ITU, except for one, were all Filipino staff. Healthcare assistants, qualified nurses, they were being hit the hardest. And every day I looked for their names. Were they still there? Were they still alive?
It's really, really scary and it's really quite worrying.
Minnie came to Bournemouth as a nurse 18 years ago. She has lost 11 of her friends to COVID-19 in the last 3 months.
Sometimes you always just think about like, oh, what's going to happen? Is it going to be me next? And then most of us support our family, you know, back home. So it's quite worrying that if something might happen, really, what's going to happen to our family and who's going to end up like, you know, supporting them.
In these, the toughest of times, the community is doing what it can to support each other.
So I cooked today, they're fried noodles, and the other one is chicken pork adobo. Yeah, it's really good.
The meals are to help her nursing colleagues and friends get better.
Oh my God! You're right. I'll make you some food.
Oh, thank you. Thank you very much. Yeah,
I'm gonna make you some chicken pork adobo and then stir-fried noodles as well. That'll be good.
For Michael, who's also a nurse, it has been a lifeline.
Most of the time, yeah, home cooking makes us much better.
Despite time in intensive care with coronavirus, he's made a good recovery.
I love it. Thank you.
It was scary. The plus for me is I did not lose my consciousness while staying in the hospital. So I keep thinking about I have to fight for it. I have to make it through and I have to see my friends after.
Seen here before lockdown, the Filipino community in Bournemouth are close-knit. They're the backbone of hospitals and care homes who have come to rely on them over the last 20 years.
We could not manage without them. 100% category, it'd be horrible. Our patients would suffer, this trust would suffer, our teams would suffer without them.
It's Michael. I'm just going to give you a drink. How are you today?
Filipinos make up around 1.5% of all NHS staff, but together with workers in social care, account for 1/5 of all recent deaths from COVID-19. That's more than any other ethnic group. To date, no one knows why.
Hopefully, there are loads of research are ongoing. So hopefully, we will find the answer. Probably there's some genetic predisposition that's happening really for Filipinos. That's why we are really prone to this virus.
Michael is already back to work in the stroke unit. If he's needed to care for patients with coronavirus in future, he says he'll be among the first to help. Alastair Fee, BBC South Today.
Well, earlier I spoke to Arlene Bautista from the Filipino Nurses Association, and I asked her how worried people are about the impact on frontline workers.
Very, very concerning. 20% of those who died are Filipinos. So Filipinos are disproportionately affected by COVID. There are so many reasons, multifactorial, why it happened and how it happened. But what I want, and speaking for the thousands of Filipinos, is that something is being done about it.
So you just said that there are a number of reasons. How concerned are you that so many of them have died with COVID?
The very main reason that I think is that many Filipinos are so subservient. You know, they can't say no. They wouldn't say no. Culturally, that's just how we were brought up. We don't like to challenge. When we do the long hours, or if we're the ones who's going to be at the higher risk areas, they just get on with it, you know. And plus, socioculturally, we still send money back home to help our families. So we will do whatever there is shifts available.
What do you think needs to be done then to help those people? You say that they are willing to do absolutely everything and not say no. How do you move forward? Because you've just set up this Filipino Nurses UK Association. You created it only last week. You realise it's very urgent, it's needed. What do you need to do?
What we want is to work with them. How can we move forward from it? And as a group, we're called Filipino Nurses Association. We would also like to have a helpline for the Filipino nurses who's got the same problem, and maybe we could do some little projects on how to teach them how to be assertive and say, you know, it is right sometimes to say no.
Do you think people will listen to you?
I think they will listen. We are going to be bigger. We know we're quite visionary. We want to work with the government. You know, we don't want to blame anybody. We just want to work with the government, and I know they will listen because we will keep our voices louder this time.
Arlene Bautista, it's good to talk to you, and thank you very much for joining us.
Thank you very much. It's a pleasure.